Welcome to the Diversity Connector podcast, where we explore the rich tapestry of human experiences. I'm your host, Gertrude Mache, and I'd like to acknowledge the traditional custodians of the country on which we meet today. I would also like to pay my respects to elders, past, present, and emerging, and together as we dive into conversations that bridge cultures, challenge stereotypes, and celebrate the unique perspectives each of us brings to the table. Each episode is a journey through stories and insights from a kaleidoscope of voices, each sharing their colorful narrative. Whether you're at home, on the go, or just anywhere in between, you're now part of a community that values understanding, inclusivity, and the beauty of diversity. So plug in your headphones, get comfortable, and let's connect through the power of our shared stories. Welcome, and thank you for joining us on the Diversity Connector podcast. Hello, everybody, and welcome back to the Diversity Connector. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating young woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, how old you are, and share your story with us today.
Hi, everyone. I'm Indah Johannes. I'm 24 years old and I'm based in Melbourne's outer eastern suburbs. I was born on the 29th of June 1999 at Monash Medical Centre in Clayton, Melbourne. I was born to an Indonesian father and an Australian mother. I grew up in a mixed race household, and growing up I had very, very strong adult role models. And growing up I had some amazing female role models. My mum, Julie, was the youngest of 4 daughters, and she grew up being the first in her family to go to university. Education was always very important to my mum, and she told my sister and I about the importance of this, and she wanted us to have the best education possible. She also taught me about resilience and not taking anything for granted. And I owe those lessons to her so much, as it shaped me as a young woman. Another role model that I grew up with was my grandma, Jenny. My grandma was also one of my carers when I was growing up. My grandma spent a lot of her time raising her grandchildren and raising her children. She is the main matriarch of the family, and she's done a lot for us. She took care of me a lot when I was younger, as did my parents. And my grandma was one of my strongest role models too. And she's very, very close to me, and we have a very, very good relationship. I grew up with a lot of challenges, but I never let those define me. One of the challenges that I had growing up was growing up unknowingly on the autism spectrum. As a child, I was always different. I felt that I could never understand the world around me, or why I couldn't socialize, or why I couldn't understand basic cues that, other people seem to understand, or children would seem to understand. And when I was about 5, my kindergarten teachers noticed these difficulties, and they wanted to see if my parents could get me diagnosed. But at that point in time, there was no proper based on the spectrum. So I went diagnosed, as they were wondering how I'd be able to live a normal life, or how I was able to survive in this world. But I was able to be resilient and to keep pushing on. And when I started school, there was a lot of challenges. I had challenges with things like reading. I had challenges with things like writing. I had challenges with friendships and with bullying. And then I kept pushing forward until I ended up in a hole. High school was an exciting experience because this is where I found out who I was, and where I found out the type of person I am and what I want to do with my life. It was there, when I attended school, that I was passionate about social justice and helping other people. This led me to thinking about careers for the future and what I really wanted to do. I was very, very young when I decided that what I really wanted to do was be a speech pathologist. And I'll talk more about this later, but it never eventuated. I was very, very keen to help other people and reduce inequalities at all levels for everybody, because I would feel a deep pain when I saw people suffering or people who were, going through unequal experiences. I really, really wanted to do something about that. And all the time I would talk to my friends about the importance of helping people and how we can do better. It was something that I was very, very interested in. All right. The things that drive me are things like resilience. I always know that when things go wrong, then it won't always define you. I also find that life isn't always linear. I spent a lot of my life planning for the future and planning things ahead, but never did any of those things come to fruition because other opportunities would come up or unexpected things would happen. So I learned that the important thing is to just have a general idea of what you want to do and accept any opportunities that may come your way, because these opportunities may never come up ever again. And also the importance, something that's very important to me, is taking nothing for granted. Because you know the old saying, you don't know how good you have something until it's gone. That is something I think about every day. I feel grateful to have the life I have, my family, my house, everything. And I make sure not to take any of that for granted. It's all very, very important. And we need to make sure that we take nothing for granted, because we don't know when those things will be gone someday, or those people may not be in our lives anymore. We need to make the most of every opportunity. I hope today in my interview, I can tell you a little bit more about my career and the things that I've achieved.
Wow. Just listening to you speak makes me realize more and more the importance of us understanding people on the neurodivergent spectrum. It's such a wide spectrum and the challenges are so different. And that's really why I put together this podcast, so that we can talk to people like you, find out what your experience is like, and make sure that when we're designing the workplace that people work, we are accommodating the needs of everybody who's working in the organization. So your journey to becoming a health promotion officer at Eastern Health, tell us a little bit about your experiences there, both in employment and in volunteering, and how this has shaped your path.
Sure. So as I mentioned before, so when I was in high school, I really wanted to do speech pathology because it seemed like a good course at the time. And then I went through school and I completed my VCE. And then I got my ATAR score back, which is like my score for, getting into a university course. And my ATAR was unfortunately too low to get into speech pathology. So I had to try and look at something else, another course. So I remember that day I went through, so I ended up studying at Australian Catholic University, and I remember looking through the ACU prospectus and I found this course that I studied, which was a Bachelor of Applied Public Health and Global Studies. And I had no clue what it was at that point. I had no idea. So I just opened up the prospectus and I put it down as one of my preferences to get in. And I thought, I might just do this and then get into speech pathology the year after or something. So I did it. And then I remember I got into the course and I started studying it and I just fell in love with it. It was just like this realization where I just went, oh my God, like this is really exciting. This is exhilarating. This is what I want to do. And that's when I realized I wanted to work in public health. I didn't know exactly what that would look like, or where I would work. I had absolutely no idea because I didn't even know much about the course going into it, but it just was like a moment. And I think with my volunteer work, so I just started my volunteer work sort of during that time when I started studying, and just seeing how much it connected to the thing that I was learning in terms of things like social determinants of health and all that kind of stuff. It just connected. Like it was just a moment where I went, oh my God, this is what I do. And I was so excited about it, and I just really wanted to pursue it. And then when the time came for me to finish my degree and get a job, I was kind of looking at various jobs, but I kind of looked in the health promotion kind of field because I did a bit of study on that, and it was kind of interesting. And I found that it was important work because it's work where, you're there to prevent people from getting sick or needing treatment, and it saves a lot of money on the health system if we're trying to prevent people from getting sick. So that kind of prompted me to, apply for a few jobs, and then eventually I got the job at Eastern Health, and I just absolutely love the work, and it's just a great thing, and I love working with the community.
So let's go back a little bit and look at the connection between social work and public health. You mentioned that you've got extensive volunteer work at St. Vincent de Paul Society. How do you see the intersection of social justice, volunteer work, and public health, especially based on your on-the-ground experiences?
Yeah, sure. So when I started volunteering with St. Vincent de Paul, I think I was about 19. Yeah, so I was 19 and a half. So, well, actually, sorry, no, I was 18 and a half. So I just finished high school, and I was just started volunteering with, so I was doing a thing called Soup Van with St. Vincent de Paul. So it's where there's like a van, it's filled up with food, and we would go to the public housing towers and low-rise homes in Collingwood, and we would knock on people's doors. We had a list of people we'd visit, and we'd knock on their doors and give them food. And we would also go, this was before COVID, we would do street stops. So we would go to the corner of Stanley and Smith Streets in Collingwood, and there'd be people there waiting for us, and we would give them soup and sandwiches and things like that. And often we would speak to these people as well. So, but that experience, so when I started that, I had never been to the public housing towers in my life. Like I'd seen them, but I'd never been in them, or I'd never met anyone who lived in the public housing towers in Melbourne. And I just remember I started my course at that time, and I started learning about, public health theory and social determinants of health. And I just remember going to the public housing towers, just going inside and looking at, just meeting people, seeing the environments they were living in and seeing where they were living. And I just remember it was like a real life case study. It was coming to life before my eyes. Like I could see just the way people were living, the poor living conditions, the overcrowdedness, and the impact that was having on their health. And some of them, had bad like health problems or disabilities, or there was just all these things. And I remember just, after I started visiting people's where they were living, like their apartments and things like that, it was just like a real life case study. Like I could see it before my eyes, what people were going through, where they were living. I'd meet people on the street. Some of them, were drug affected or alcohol affected. Some of them, may not have had any family or social connections. And often some of the people who would come to see us volunteers, they would want to have a chat with us and talk to us because they, didn't really have anyone else to support them or chat to. We were like their line. So it was just like a real life case study. And that, and just studying that and seeing that firsthand, it was it just awoke this thing in me about, oh my God, it made me realize the importance of my work and degree. And it made me realize that this is what I want to do. And when I saw what people were going through and saw how they were living, it just opened my eyes up. I just felt so naive because I'd never seen anything like it or met anyone from the towers or from that kind of environment. And it just really opened my eyes up.
So you then went and got involved with the Global Health Youth Connect. How has working with students from Melbourne University expanded your perspective on the issues of global health?
Yeah, look, it was a really good experience for me because when I got involved in Global Health Youth Connect, when I got involved with Global Health Youth Connect, I was just a bachelor's student at that time. And a lot of the people that I did Global Health Youth Connect with, they were all like master's students. So they were, on a different, they were studying like a degree higher than me. So it was really interesting, working with master's students and, seeing global health issues. And I got particularly passionate about, the sexual and adolescent health side, which I got really involved with. But Global Health Youth Connect, I found it was a good experience for me to do some health promotion kind of stuff, because I was able to do that whilst I was studying and to get that experience and to, work with other students from Melbourne Uni. But it's also helped me to form relationships with, master's students who currently study there. And a lot of them have asked me a bit about my career in health promotion, have been wanting to know what it's like so they can work in that field. So it's been a good connection sort of way, or networking way, and also to help us talk about health policy. One thing actually that opened my eyes up was a lot of the time Melbourne University and Global Health Youth Connect, they would have like big global health forums and things on weekends and that, or seminars. And I remember sitting in a session one day, and there was a girl from Deakin University, and she was studying her master's around the impact of climate change on public health. And this might sound a bit silly, but I didn't know or understand about how climate change was impacting health, because I'd never been taught that. Like, I was never taught that at school or at university in my bachelor's degree. I didn't really think about that or know that. And this girl did a whole presentation about it. And I just remember thinking, oh my God, like, how could I not have known this or been taught this? Like, it was just insane.
That's why it's necessary. So you're also part of the sexual and adolescent health team. Why do you think it's essential to educate high school students about these topics? And what are some of the misconceptions that you've encountered or challenges you've encountered so far?
Yeah, so for me personally, the thing that prompted me to sign up for the sexual and adolescent health group was that I grew up in a bit of a Catholic conservative kind of background. So I grew up, never talking about sex. It was very taboo. And the funny thing is, during that time when I joined Global Health Youth Connect, it was back in 2021. And during that time, there was, the stuff that came out in the media about the politicians, staffers in Parliament House who were being sexually assaulted, and Brittany Higgins and Grace Tame. And also during that time, there was activism from Chanel Contos, who was a girl from Sydney who was advocating for better respectful relationships and consent education. So during that time, when I started doing Global Health Youth Connect, it was like a very hot topic in the media at the time, about consent, about workplace safety, about women's safety, the March for Justice. There were all these things going on in the country and in the media that everyone was getting more awareness of and talking more about. And when I started doing this Global Health Youth Connect work, it was during that time of, discussion in the press. And I remember just thinking, I remember at that time, I was like 22 at the time, or nearly 22 years old. And I didn't know what consent was until that point in time. And I look back now and I just think, oh my God, like, why didn't I know what consent was until I was 22 years old? Like, that just really shocked me. And I just felt so silly, because, it was just and I felt like I learnt more about sex doing this work with Global Health Youth Connect than I did in school, because I attended like a Catholic all girls school, and the way that they taught sex, they did it kind of in conjunction with religious education. And the word consent was not mentioned.
Wow.
Was not mentioned once. So I had to learn that when I was in my 20s, which I thought was just, ridiculous. But sex education is needed, because, because young people, they need to learn about it. I know it's a bit taboo.
but it's happening.
Yeah, I know it's
Every young
taboo, but I know in my work in health promotion, you know, we do a little bit of respectful relationships work, or we work with local schools to implement or teach their students about respectful relationships. But it needs to be taught, because if we don't teach kids about it or we don't talk about it, then, you know, how are we going to know? And how are, you
the
know,
kids.
young people going to be able to have sexual interactions with people without understanding consent and boundaries and all that kind of thing? So it's really important that we talk about it, because it's a fact of life and it's natural and it's
Yeah,
normal, and we need to stand it so that we don't have any
it is.
issues.
That's so true. So what goes into creating content like students' booklets, tutorial booklets, and presentations? And how do you ensure the information is both accurate and engaging for your audiences?
Yeah, sure. So when we were making the content, it was all very remote. So I didn't meet any of the people in my Global Health Youth Connect group until, I don't know, probably later on in the year or something, because we were just we did it all remotely. But basically we used Google Drive. That was an effective way. So we used that to all edit and share the work, and be able to use technology like Google Docs and Google Slides and things like that, so we could all change it and edit it and work on it, you know, at the same time or different times, whatever. And we made sure that the content was appropriate for young people. So we made sure it was kind of, you know, easy to read, on their level, their kind of language. We also got feedback from other people in Global Health Youth Connect who were working on other projects, but also they were able to help us. And we also got some feedback from some organisations. And yeah, and it did take a lot of time. Like something we did, I think it was what we did was we did a podcast, and the podcast was called Eggplants and Peaches. I think we had about 4 or 8 episodes, and we did some interviews and some factual episodes. And one of the tasks that I had to do was edit the podcast, and that took a very long time, particularly if it was a 1-hour episode. It would take me about 2 hours to edit everything and put, you know, intro music in and shorten it and all this kind of stuff. So I
Yeah,
did the podcast editing because I had experience with it, so I was happy to take that on. But it was a really exciting thing to be involved with, and it also built my skills for the workplace as well, like with, you know, communication skills and written communication and yeah, just and deadlines and all these types of things. So it was a really effective way.
it would have stretched you quite a bit. So podcasts are becoming increasingly popular as educational tools. How do you think they compare to the traditional teaching methods? And what's the value of utilizing them to discuss health issues?
Yeah, look, podcasts, I really love podcasts. Like, I feel like in the last couple of years, I've become more interested in either making podcasts or listening to podcasts, because I find that there's such variety. You can find a podcast that you like based off your interests, or, you know, or if there's a certain person you like to see online or whatever, you can listen to them. Like, there's a lot of different podcasts for everybody, and they're very convenient as well. So you can listen to them in the car or on your way to work or wherever you are. They're very, very convenient. But
Yeah.
also I feel like podcasts allow time for you to listen and to hear people talk about certain topics or certain stories in the media or certain issues in a bit of a longer time than you would, you know, generally if you're listening to the radio or having a quick discussion or whatever. I feel like it's like a way of you listening more about, you know, about all these topics and issues and things going on. And, you know, it's good for people as well with different kind of learning styles and processing information. Like, I find, you know, for me personally, sometimes I like listening to podcasts, or I'll have like, you know, something read out loud, because it helps me digest the information a bit quicker, or I can pause it or rewind or something, or skip ahead or skip back or pause or anything like that if I need time to process the information or remember what was said, or, it's just a good way for some people it's a good way to learn information. I think for health, there's a lot of podcasts out there about lots of different health topics, and listening
Yes.
to those podcasts, you can get more of that information quicker.
So you describe yourself as resilient and confident under pressure. Can you share a specific experience where these qualities were put to the test and how it shaped your approach to public health?
Yeah, sure. So I find that in the field of health promotion, sometimes things might be delayed, or sometimes things may or may not get done. And that's sometimes the nature of it. So sometimes, you might have stakeholders that might pull out or have a change of plans, or sometimes you might not have the funding, or you might be delayed in something. There's all sorts of things that can happen because I work on a 12-month plan to get things done. So I find sometimes it can get a little bit stressful if there's something I was going to do, but it might fall behind because of a certain stakeholder, or it might fall behind because of funding or because of timing or anything. And that can happen a lot, I guess, in any profession. But yeah, health promotion, sometimes that happens. One time I had something I had to do on the plan, which was work with the local Aboriginal health team, or the local Indigenous organisation, to deliver a tobacco cessation strategy. And this particular organisation I was working with, they were waiting on some funding and couldn't work with me. So I thought, okay, how am I going to, I had to come up with an alternative. So the alternative that I did was to have a presentation to people, to the local community, about smoking cessation. So I did that on World No Tobacco Day, which was in May. And I did an online webinar one evening where I presented information about tobacco cessation and health promotion, how we address it. And then I had one of the respiratory nurses from my hospital join as well and present. And we had a couple of people attend. But that was an example of me having to change or adapt to a situation, because I needed to do something where I had to change something because it was not working how I originally expected, but I had to come up with an alternative in order to make sure it was completed.
I love that. So, given your wide range of experiences, what advice could you offer to someone aspiring to a career in public health or a related field?
Yeah, look, I would say absolutely look into it, or absolutely do it, because it is a growing field, and I feel like it's very, very important, particularly in the future. So we need more people to work in public health. And as you've seen, like with COVID-19, and also, with the threat of climate change and things like that, but we need more public health professionals involved. And I find that my advice would be just to probably network and make connections. I feel like that was the best way that I was able to get a job, was by, going to university events, or going to, external sessions, or going to forums, or going to seminars and things like that. You get to meet all sorts of people, and you get to connect with people, and, learn about their experiences, and, try, and also as well apply for as many jobs as you possibly can as well. That was something that I did extensively, and eventually I got one. So it will
That's
take a
good.
bit of time. Just apply for whatever comes up. And also with public health, just find an area of health you're passionate in and run with it. I think if you've got a passion for, let's just say, LGBTQI plus inclusion, you could look at jobs in that field. Or if you've got a passion in, alcohol, drug use, go into that field. Or if you have a passion for sexual health, go down that field. Like, there's so many different fields in health promotion or public health that you could specialize in or work in. It's all about finding that kind of passion, and there's definitely going to be some kind of job or opportunity in that area, because public
Yeah.
health is something that will always be important.
So, to finish off, what's next for you? Are there any specific projects or initiatives that you're particularly excited about for the near future?
Well, something I've been really passionate about, and it's something that, I've realised since being diagnosed on the autism spectrum, but I'm really passionate about disability inclusion and particularly neurodiversity inclusion. That's a field I would love to work in the future. Like, there's some organisations and stakeholders I currently work with, so I'd love to work in the field of, I know recently I was working with an organisation called Women's Health East, and they did a project for 16 days of activism called Margins to Mainstream. And it was all about, it was talking about helping women with disabilities, making sure that they're okay from domestic violence, or making sure that women with disabilities are, treated with respect and treated equally, and not being, you know, affected by domestic violence. It was a really good, they did a whole video presentation where they got some local women with disabilities to share their experiences, and it was a really powerful project. So I want to do a bit more work in the women with disabilities space. I also have dreams of doing it. I have a lot of things I want to do. I really want to do a TED talk in future. That's on my bucket list.
Okay. I need to talk about that.
Yeah, I really want to do a TED talk. It's on my bucket list. And also what I'm really interested in is maybe in future I'd love to get into politics, either in a state or a federal level.
Fantastic.
So,
well, you are aspiring for big things. This is exciting. And I at least can say I met you before you got into it.
So with my work with St. Vincent de Paul Society, I've also noticed a lot of health challenges from the experiences that people have. So, for example, one of the issues I've seen is drug problems. So I think this might have been back in 2020. I went to the safe injecting rooms in North Richmond to deliver food. So we delivered food out the back for them to have inside. And then I went into the van and we drove to the front of the safe injecting room, and I remember seeing these three people. They looked like they were camping out the front of the safe injecting room. And I remember walking up to them to give them some hampers. We had some rough sleeper hampers. And I remember walking up to them, and as I went up to them to give them a hamper, I remember seeing someone with a needle in their arm injecting themselves, like as I approached them. Like, I went to give them food and they were injecting themselves out the front of the safe injecting room. And that was a really confronting experience. And I saw that during COVID, like in lockdown, and these people were just camping out the front. And it was really quite confronting seeing them, injecting themselves with drugs right in front of me and outside the safe injecting room. We also have a lot of issues sometimes with mental health. And during COVID, it was a real problem, particularly with lockdown, and for the people living in those houses, it was a bit of an issue. We've also had issues with discrimination against with clients who we see being discriminative, like racist towards other people. So, for example, one time I was doing soup van in Sunshine and St Albans, and I remember we would park the van, we would have food available for people to grab, and we would have a line of people lining up to get food, and sometimes there'd be a bit of racism and discrimination amongst the people in the queue. So there'd be some people being racist and discriminative towards some of the other people that were in the queue. We've also seen people fighting in line, or people drinking, or people arguing or cutting the line. And sometimes as volunteers, we've had to step up and say, all right, we'll have to leave if you don't, behave. So I've seen quite a lot of different behaviours, ranging from drug use to mental health to discrimination, within my volunteer work with St Vincent de Paul.
What a wide range of experiences you've had. Thank you so much for coming online and sharing these stories with us. The whole neurodivergent spectrum is a very, very big field that a lot of organizations are just tapping into, finding ways to support their staff, finding ways to recruit people who do have any type of neurodiversity abilities, not disabilities. And so I think your work is going to be cut out for you in the future. Thank you for sharing with us today.
Thank you so much for having me on, Gertrude.
Absolute pleasure. And thank you to everybody who's tuned in today. The Diversity Connector is bringing people from diverse backgrounds together. Today's story was not just about autism. It was a story of a young woman who has an intersectional persona, having an immigrant father from Indonesia, growing up in Australia, the experiences she's had firsthand. So tune in again tomorrow when I interview yet another amazing person. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world. And bye for now. Thanks again, Indra.
Thank you.
And that's a wrap, everybody, on today's episode of the Diversity Connector podcast. Thank you for tuning in and being part of our vibrant and global conversation. I'm your host, Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a tapestry of diverse perspectives. Remember, every story you've heard today is a thread in the larger fabric of our shared humanity. So, as you step back into your world, carry these stories with you and let them inspire you to embrace and celebrate the rich diversity around us. Don't forget to subscribe, rate, and review our podcast to help us share these inspiring stories with more listeners. Do follow us on social media by looking for the Diversity Connector podcast for more updates. Until then, keep connecting, keep listening, and keep celebrating the beauty of diversity. This is the Diversity Connector podcast signing off. Stay curious, stay open,